for 2 minutes, 30 seconds. And walk into the room. The room is neat, it's organized, everything's in place. Patient is sitting up, happy looking, well groomed. And I introduce myself. Hi, my name is Sierra. I'll be your nurse for this assessment. And what is your name?
Alli and Sierra.
Let me see your name, band. Thank you. And what is your birthday?
12/27/86.
And do you know where you are and why you're here?
Mission Carmichael, and I'm here for an assessment.
Right. Patient is in O times 4. And okay. Before we start this, are there? Do you have any urgent need to use the bathroom?
No.
Are you in any pain that you know about? No. And are you having any difficulty breathing?
No.
No. All right. Then we're going to go ahead and start. Is it all right if I touch you?
Sure.
All right. Get your book cold. So I'm just going to touch your neck. So temperature, skin temperature is warm. Her skin tone is even, pink, and dry. And I'm going to check skin turgor. She's got no tenting on the clavicle. Her face is symmetric, and she's got no periorbital edema. No, nothing. And what I'm gonna shine this light near. Oh, thank you. I'm gonna shine this light near your eyes, but not in your eyes. So don't look at it. So pupils are equal and responsive. Big and strict. Okay. If I could have you look at the tip of this pen and keep your head still and just follow with your eyes. And then keep looking at it. I'm going to touch it to the bridge of your nose. Okay, thank you. She has perla, and her pupil, or her EMOs are equal without nystagmus. Nystagmus. Thank you. Yeah.
Yeah, that's what you said.
Oh, no, EOMs. Whatever. All right. Your lips are a little on the dry side, but pink. Teeth are intact and straight, free of decay. Can I have you open up your mouth for me, please? Tonsils are +1. Her mouth is pink and moist. Tongue is pink and moist. Can I have you say ah, please? Ah. Cranial nerve 10 is working because the uvula rises with phonation. Can I have you stick out your tongue for me and then move it from side to side? Okay, cranial nerve 12 is intact. Tongue moves without tremors. And open your mouth again. Ah. Gag reflex is intact, so cranial nerve 9 is intact. Okay, if I could have you follow my motions with your head, just look up to the ceiling, look down to your lap, look sideways, and the other shoulder, and then if I could have you touch your ear to your shoulder, and then the other side. And then for, well, you would be sitting in bed if I was doing this, but, so at a 45-degree angle, if I could have you look left, please. And she has no JVD at 45 degrees. And her hearing and speech seems to be clear and it's for, yeah, it's just, you can hear she converses easily, and her speech is clear. All right, so for now I'm just going to have you do range of motion for your arms. If they want for just plain, just lift them above your head, and then down and then if I could have you cross your arms for me, please, like this. Okay, grab onto my fingers, squeeze as hard as you can. Okay, you have good strength, so I'm going to pull against your arms. I want you to resist me. Okay, now I'm going to push against them. Good strength. Thank you. Her grip strength is 5 out of 5. Her elbow strength is 5 out of 5. Let me check your radial pulses. They are even, and grade is +2. Your cap refill is less than 3 seconds. Thank you. All right. If I can have you just lift your arms up like this, I'm going to check your chest configuration. So, transverse is less than, well, AMP, anterior and posterior, is less than transverse. So it's elliptical. I'm going to listen to your heart. So it's S1. Oh, that's S1. Oh, that's the focus.
Yeah.
That's focus. Oh, okay. So it's just, so then your apical pulse is just, for women, it's underneath the breast. Fifth, mid-clavicular, fifth intercostal, down on the left side. Take a apical pulse for a minute. And your heart is RR, regular rate and rhythm. Sorry. Now I'm going to check your lungs. So just take nice deep breaths. If you feel like you're going to be lightheaded, just let me know and we can stop. Okay? So take a deep breath for me, please. In through your mouth and out through your mouth. Another deep breath. Another deep breath. And one more for the front. All right. Your lungs for the anterior are CTA. And your respiratory pattern is even and unlabored. Do you have any cough? No? Any sputum? Okay, no cough or sputum. She doesn't seem to be having any difficulty breathing, so she has no retractions, and I don't notice any flaring of the nostrils. And bowel sounds. So her contour is rounded, and
how do you check that?
oh, they'd have to be flat. Thank you. Oh, so if you were in bed, so raise the head of the, or lower the head of the bed, so now you're laying flat. As well as I can get. All right, so contour is rounded. I'm going to check for bowel sounds, starting in the left lower quadrant. Okay, bowel sounds in all quadrants, so it's normal active. And are you passing any gas? No. Well, are you able to? Okay, just means your bowels are working good. And are you having any nausea, vomiting? Any problems with constipation or diarrhea? No. And when was your last bowel movement? Yesterday. Yesterday. All right. And are you having any problems with incontinence or holding your bowels, controlling them? No. And so no with that. And how many